ExCPT exam prep pharmacy technicians practice test, 25 most asked questions. Question 1. What is the generic name for Vicodin? Oxycodone/acetaminophen, hydrocodone/acetaminophen, hydromorphone, fentanyl. Vicodin is a combination of hydrocodone and acetaminophen. Question 2. Which federal agency regulates the disposal of hazardous waste in a pharmacy? FDA, DEA, EPA, OSHA. The Environmental Protection Agency, EPA, regulates hazardous waste disposal. Question 3. How many milliliters, ml, are in 1 teaspoon, TSP, 2 ml, 5 ml, 15 ml, 30 ml? 1 teaspoon equals 5 ml, 1 tablespoon equals 15 ml. Question 4. Which law requires pharmacists to offer counseling to Medicaid patients? Pure Food and Drug Act, OBRA 90, HIPAA, Durham-Humphrey Amendment. The Omnibus Budget Reconciliation Act of 1990, OBRA 90, mandated patient counseling. Question 5. What is the Tallman lettering version of hydralazine? Hydralazine, HYDRLazine, hydralazine, hydralazine. Tallman lettering, hydralazine versus hydroxyzine, helps prevent lookalike/soundalike errors. Question 6. A prescription reads 1 tab per QID x 7 days. How many tablets are dispensed? 7, 14, 21, 28. QID equals 4 times a day. 4 tabs/day * 7 days equals 28 tablets. Question 7. Which drug class does lisinopril belong to? Beta blocker, ACE inhibitor, calcium channel blocker, diuretic. Lisinopril is an angiotensin-converting enzyme, ACE, inhibitor. Question 8. What is the correct temperature range for a pharmacy refrigerator? 0 to 2 degrees Celsius, 2 to 8 degrees Celsius, 8 to 15 degrees Celsius, 20 to 25 degrees Celsius. The standard refrigerator temperature is 2 to 8 degrees Celsius, 36 to 46 F. Question 9. Which of the following is a Schedule II controlled substance? Tylenol with codeine, alprazolam, Percocet, Lamitil. Percocet, oxycodone/acetaminophen, is a Schedule II drug. Question 10. What does the suffix olol usually indicate? ACE inhibitor, beta blocker, antifungal, antiviral. Beta blockers like metoprolol and propranolol end in olol. Question 11. A laminar flow hood should be turned on for how long before use? 5 minutes, 15 minutes, 30 minutes, 1 hour. Laminar flow hoods require 30 minutes of runtime to stabilize the air. Question 12. Which form is used to report the theft or significant loss of controlled substances? DEA Form 41, DEA Form 106, DEA Form 222, DEA Form 224. Form 106 is for loss/theft, Form 41 is for destruction. Question 13. What is the primary use of the drug warfarin? Antibiotic, anticoagulant, anticonvulsant, antidepressant. Warfarin, Coumadin, is used to thin the blood and prevent clots. Question 14. The term USP 797 refers to guidelines for non-sterile compounding, sterile compounding, hazardous drugs, patient privacy. USP 797 sets standards for sterile preparation of medications. Question 15. Which of the following is an auxiliary label for an antibiotic suspension? Take with food, may cause drowsiness, Shake well before using. Avoid sunlight. Suspensions must be shaken to ensure uniform dosing. Question 16. If a drug has an expiration date of October 2025, when does it actually expire? October 1, 2025, October 31, 2025, September 30, 2025, January 1, 2025. Expiration dates refer to the last day of the month specified. Question 17. What is the maximum number of refills allowed on a Schedule 3-4 prescription? 0, 5, 11, unlimited. Schedule 3 and 4 drugs can be refilled up to 5 times within 6 months. Question 18. Which drug is used to treat a fungal infection? Amoxicillin, fluconazole, ciprofloxacin, acyclovir. Fluconazole, diflucan, is an antifungal. Question 19. How many grams of dextrose are in 500 ml of D5W, 5G to 25G, 50G to 250G? D5W is 5G per 100 ml, so 5*5 equals 25G. Question 20. What does the root nephro mean? Liver, kidney, stomach, lungs. Nephro refers to the kidney.